Hello, everyone. My name is Sidharth Chan, and I'm a student at Harvard Medical School. Today, I'm presenting a project on factors predicting cutaneous abscess and MRSA infection in pediatric cellulitis. Cellulitis is a common infection of the skin and skin-associated structures that typically presents with expanding redness, warmth, and pain of the affected area. Such infections occur more rarely in children than in adults. Cellulitis can be complicated by formation of a cutaneous abscess, which often requires incision and drainage for definitive treatment. Importantly, cellulitis can also be called by methicillin-resistant Staphylococcus aureus, or MRSA, that can be detected by culturing purulent drainage or abscess contents when present, and necessitates treatment with antibiotics having specific coverage. This study was conducted on pediatric patients hospitalized at a tertiary academic center with cellulitis, with the goal of identifying risk factors predisposing to either formation of cutaneous abscess or evidence of MRSA infection by growth on wound culture. In the patient selection, those meeting specific exclusion criteria, such as having intensive care unit admissions or having complicated infection sites, such as those overlying recent surgical sites, were removed in order to reduce confounding by such complex factors. This ultimately left 559 hospitalized pediatric patients included in the study. The model procedure began first with tabulation of patient characteristics. Next, each characteristic was compared to each of the outcomes of interest, with identification of characteristics correlating with a p-value of less than 0.1 as preliminary risk factors. Lastly, the set of preliminary risk factors was included in a multivariate logistic regression predicting each outcome of interest. Odds ratios having 95% confidence intervals excluding one were identified as the final risk factors. Here are some baseline characteristics for all patients. As you can see, both males and females were fairly equally affected, with most infections occurring in the head and neck, followed by the groin and buttocks. Notably, laboratory evaluation was highly prevalent, with almost all patients receiving a CBC. The first model was for prediction of cutaneous abscess among all patients. Only a few factors emerged as significant independent predictors, and most notably, infection of the groin and buttocks region was the strongest predictor. These results showed that infection of the groin and buttocks region independently predicted cutaneous abscess formation, even without adjustment for laboratory factors as demonstrated on a supplementary analysis. In addition, previous results from our group have shown that physical examination is the preferred method for detection of cutaneous abscess in children presenting with cellulitis, as opposed to imaging. The second model was for prediction of MRSA growth on wound cultures among all patients with wound cultures obtained. It should be noted here that wound cultures were defined as those taken from purulent drainage or abscess contents. MRSA nasal carriage was a very strong predictor of MRSA growth on wound culture. Quite notably, cutaneous abscess was not a predictor for MRSA infection. Altogether, this model reveals that MRSA nasal carriage is a strong independent predictor of MRSA growth on wound culture. Furthermore, negative MRSA nasal swab is also a strong negative predictor of MRSA growth on wound culture when segmented in a supplemental analysis. This presents MRSA nasal swab as an attractive option for detection of MRSA infection, as these swabs typically result fairly quickly and can be used to guide judicious use of antibiotics. Interestingly, infection of the groin and buttocks region also predicted MRSA infection. The exact reason for this observation remains somewhat unclear, but MRSA colonization of this region in young patients has previously been linked to multiple factors, including hygiene standards and diapering. In conclusion, both MRSA nasal carriage and infection of the groin and buttocks region emerge as strong predictors of both cutaneous abscess and MRSA growth on wound culture. Patients with groin and buttocks cellulitis should be thoroughly evaluated for cutaneous abscess. And given its strong predictive value, MRSA nasal swab should be considered to guide the judicious selection of antibiotics, particularly to minimize overuse of broad-spectrum coverage. Lastly, other laboratory evaluations, such as complete blood counts, added little value in prediction, and indiscriminate acquisition of blood work in these patients should probably be avoided. Here are some references, and lastly, thank you so much for your attention and interest.